Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jean Sarnowski, and on today's program we're going to learn a little bit more about the Safety Net program by LoJack. And we're lucky enough today to have on our program Ralph Poland, who is the retired from the Marshfield Police, now law enforcement liaison for Safety Net by LoJack. I wanted to make sure I got that right. Thanks so much for being here today.
Well, thanks for having me.
Your time. I was fascinated by all the information ahead of time, and we had someone on our staff who had given me your name and said, "Oh, he's fabulous. He's got this great program." So it'll
fantastic.
Be good for viewers to learn about it.
Whatever it takes to get the word out.
Yeah, that's great. Now, I'd like to start with tell us about yourself, so the viewers have some sense of how long you've been involved and what your interest.
Yep, I went on the Marshfield Police. I did 14 years there on 2 different stints, and in between time I did 3 years with crime scene investigation for the Plymouth County Sheriff's Department. That's
interesting.
It was. It was. It certainly was.
So what's your background? Have you always been in this? You've had this field of interest? Or?
Well, pretty much, yes. When I was in the military, I was photography. I was in a combat photography unit, and we did, during that time, we also did crime scene and photography and investigation for the military police when they needed it. So I had a little bit of a background in crime scene, and then when I went on the police department in Marshfield, we actually had our own crime scene lab where we processed our own film and did fingerprinting and so forth.
Oh, yeah. So your interest kind of continued from your time in the service.
Exactly, yeah.
That's great. Now, tell us about the LoJack program.
Well, the Safety Net program is
Are those 2 different things?
It's the same company. LoJack, they've been involved in recovering stolen cars for 26 years.
Oh, all right.
Boston Police was the first police organization to come on board with LoJack.
Okay.
And now it's an international company. They're all over the world. And an offshoot of the LoJack company, which is a Safety Net, it's still LoJack, but it's the exact same tracking system that they use for stolen cars. They figured if we can find stolen cars, why can't we find lost people?
Good plan.
So that's how this came about.
Now, how about we just describe what this is for the viewers?
Sure, it's a radio frequency tracking system. It's not GPS or cell, and a lot of people get confused with that because there are situations where you would lose a GPS signal if you didn't have line of sight to a satellite.
Right.
And the same thing with everybody knows that sooner or later you're driving around or walking around and you lose your cell service. With radio frequency, it literally will go through anything. It'll go through steel, brick, wood, water. It's good for 18 feet below water. So in a situation where somebody would be missing, say, from an assisted living facility in a multi-story building, if somebody was noticed by the staff that somebody is missing, did they leave the building? We don't know. With this system here, we could literally determine that within minutes, whether they actually got out of the building or they're still in it.
Well, then how far would they get before we lose them? Is there a distance?
Well, what this is, it's a 911 call immediately. Someone's missing and we need to find them now. Because it could be, 3 o'clock in the morning, February, snow, a blizzard. You don't have a lot of time to find somebody.
Right.
So with this system here, it's operated by law enforcement or whoever the search and rescue organization is for the particular area. So the 911 call would go in, and there's an antenna that I don't show here, but goes on top of the vehicle, either a cruiser or a fire apparatus. And you would, from the police station or fire station, you would go toward the last known place where this person was, which would be an assisted living facility or their home. And the reason for that is they start at the police or fire station instead of just going there immediately, because theoretically you could pass that person on the way.
Right.
So the antenna is going to pick them up wherever, if they're in a quarter of a mile of that vehicle. So as the vehicle is going along, it's got a quarter of a mile radius, and once the signal is picked up, then the officers are trained that they know that once it gets to a certain point, they stop, disconnect it from the antenna on the roof, and connect it to the Yagi antenna. And at that point, there's a 2-mile distance.
So it's a portable?
Yes, this is absolutely portable. It's battery charged. It's plugged in and left charging all the time. So it's on a full charge always. And once the directional antenna is hooked up, it almost immediately tells you that the person we're looking for is somewhere in this area. No one has to go that way looking for
Right.
him. So it eliminates about 180 degrees of search area right off the bat. And then from that point, as you adjust the receiver, it literally comes down to that transmitter. So if somebody were hiding, if they were hiding, you know, like in somebody's shed, in the back of a yard, or they were hiding in a building, in a closet, could literally find them in minutes. And it's not because of the, you know, you're going to see the person, because that radio frequency is looking for this transmitter. So if it was under a bed, in a closet, on the 3rd floor, in the attic, it doesn't matter, it's going to find you.
So does it ping, like you think of?
Yes.
As you get closer, you get a stronger signal?
It's got an audible sound, and it also has a visual spike that goes across the screen. But we train the officers to listen to the sound, because the closer you get, the louder that sound's going to get. And what happens is, as you're going along, you know, tracking with this left and right, up and down, and you come to a spot where all of a sudden you lose the signal, that means you just passed the person. They're behind you now.
Oh.
So it's search time is literally minutes. You know, there's been situations where, you know, people have gone lost and they've gone for hours, days. Sometimes you don't find them. And the average search time with the system here from Safety Net is about 30 minutes.
Wow.
Usually less.
So who's eligible for
Anybody with a
Safety Net?
cognitive issue. It could be Alzheimer's, dementia. It could be children with autism. It could be a veteran coming back with a traumatic brain injury. Anybody who would have a cognitive issue that would cause them to have the possibility to wander away from their caregiver.
Okay, so are they necessarily under someone else's care? They have to be under someone else's care?
Yes, there has to be. The criteria to be on this program is they have to have 24/7 observation, not so much care, but
Okay.
they have to be with somebody.
They're under watch by someone.
Exactly. So it couldn't be somebody that would be, say, have a parent that was living with them, and the family would go to work at 8 o'clock in the morning and then come home at 5 o'clock and discover that person's gone. Did they have 10 minutes lead or
Right.
4 hours? You know,
Okay.
you don't know. So there has to be somebody be able to know where they are all the time.
Okay.
The other thing is they have to not have access to a vehicle or the possibility of public transportation. And then, of course, the third thing is a diagnosis of a cognitive issue.
Okay. Wow. So how long have you been working with this program?
I retired from the Marshfield Police in January of 2012. I started working with Safety Net part-time in 2012, and as of the first of the year, I've been working full-time with them. And as of the first of the year, we've decided, or the company has decided, that what we're going to do now is we've trained sufficient law enforcement and public safety organizations in the state of Mass, Connecticut, and Rhode Island, that what we want to try to do now is get the word out to the
Right.
to the public that this is available to them.
So how does that happen? Someone sees this on TV and they call you and say,
Right. They can either call the 800 number, which I don't have in my memory, but it is 877-434-6384. They can call and enroll somebody over the phone, or they can go on the website, which is safetynetbylojack.com.
okay,
And they can enroll somebody online if they wish.
Okay.
Or in some instances, such as Barnstable County, the Sheriff's Department is trained and equipped with this tracking equipment. So somebody could literally call the Sheriff's Department and
Okay.
ask for information.
say, hey, I saw this product.
Right.
All right, and you're Marshfield, if they're up there, I mean, this broadcast's up there too, so they
Sure.
can call Marshfield, please?
Absolutely, yep. Marshfield Police and the Marshfield Fire Department are equipped with this program.
All right. So are you contacting the organizations to help develop this first before going out and then go out to the public to say this is where you can get it, or
All of the above.
all of the above?
All of the above. We are ready right now. The state, like I said, the state of Mass, Connecticut, and Rhode Island is basically covered,
Okay.
even to the islands. We've trained the state police, the Massachusetts State Police, almost all the county sheriff's departments in the state have been trained and equipped. And then there's I think it's over 58 individual police and or fire departments that we've trained and equipped with this.
Okay.
So in some instances, like Hopkinton, the town of Hopkinton,
Right.
the fire department is the search and rescue organization there. So the fire department is trained and equipped.
Okay.
And then there are other departments which just the police. And then there are other departments like Marshfield where it's both.
Okay.
So,
And then do they have a list of the consumers that own the
yes.
wristband?
Part of the program is that we have a database that the law enforcement will have access to, and what they can do is if, say, somebody were missing from an assisted living facility in Harwich,
Okay.
the people at the assisted living facility would dial 911 to the Harwich police and say, we're missing somebody, and her name is Mrs. Smith. The Harwich police can go on our website and look up her information. They'll have a photograph of her.
Okay.
They have her ID and transmitter number. Any kind of issues that may have come up through the interview when they first enroll,
Right.
or sometimes people that wander with Alzheimer's or dementia sometimes always go to the same place because it's a familiar thing to them, maybe a place where they used to work or a place where they used to live. And all that information is on this database. So in an instant, law enforcement has all of that information, and in some instances, they have that information on what's called an in-house system in their computers. So every police officer out on the street would punch in that person's name in the master names of their PD, and everybody on the street now has a picture of that person that they're looking for.
Wow.
Because especially, you know, it would be really with anybody. I'm looking for a 75-year-old white female with white hair, times 1,000. You know, but
Hard to narrow that one down.
right, yeah.
Yeah.
But right now, with the way the system works, every police officer on the road can bring that person's picture up. They know exactly who they're
What they
looking
look
for.
like. All right. So then you have the unit on your wrist.
Yes.
Fascinating. Looks just
Yep.
like a watch, a little bit bigger.
Yep.
How does a consumer get that?
Well, again, they would call in and, you know, have somebody enrolled.
Okay.
And what happens is there's a whole package that's sent to the caregiver.
Okay.
And it's the transmitter, a number of straps, and the connector. The connector is a one-way. Once you put it on, you can't take it
Yeah,
off.
that would be a good question.
And there's a battery in this. The battery is changed every 6 months.
Is it a standard?
It comes
Hearing
with
aid size, or?
no. It's about the size of a nickel, but it's a specific
okay.
battery for this transmitter,
Okay.
and those are supplied with it. Also, a supply of these bracelets. People can, when they go on the website, you can see all the different
All the
colors.
different colors we have
So
on the table, yeah.
some people will say, "Oh, I want all pink," or "I want a variety pack," or whatever they want. So they would get that.
Yep.
Because in a situation like with somebody that may have to go into a hospital and have an MRI done, this is transmitting a radio frequency every second. It never stops. So if they had to go into a facility like that to have an MRI or something like that,
Yep.
the caregiver would cut the bracelet off,
Right.
take the battery out, do whatever process they were going to do, and then when it's all over, put the battery back in and put a brand new strap on.
Okay.
So that's why there's about a dozen straps are giving with the kit. Also, there's like little refrigerator magnets with the ID and the frequency that are on it. There's business cards, wallet cards that you would give, say like you would keep one for yourself, obviously, and then if it was a husband or wife or somebody that was going to a daycare, you
Okay.
would make sure the daycare had that. So if the person ever went missing from there, then the daycare doesn't have to call the caregiver
Family.
to try to track them down to find out what the frequency is and so forth. They know right off the bat. And the same thing with children that are in school. Information is given to the teachers or their aides in the classroom.
Right.
And then there's a tester that comes with this system that you touch it to the transmitter and it blinks red, which means that it's
Good to
working.
go.
Yeah.
Yeah.
So the only time red means good.
Yeah.
So
working.
it works, and if it doesn't, the first thing we ask is if that doesn't blink, and we tell people to check it every day.
Okay.
Twice a day is even better, in the morning and the evening. And if it doesn't work, the first thing you do is change the battery, and if it still doesn't work, the next thing you do is call us, and we'll replace it immediately.
Okay. So that stays on all the time?
Right? You can take a
Shower
bath,
with it, bath with it?
shower, swimming, doesn't matter. The strap is actually seatbelt material. So if it gets wet, it kind of like the moisture just dissipates
Beads right
almost
off
right
of it,
away.
right,
Yeah.
right. And how easy or difficult is it to replace that strap or cut it for a little kid that might say, hey, I can get this off, or even
Well, they're not going to pull it off.
Okay.
And then what we suggest, we have a little tool that kind of looks like a letter opener that the caregivers would use to cut this off. And they've discovered that instead of doing it with scissors, that kind of imprints in the child. That,
I can
that's
do this.
how I can get this
Even
off.
an elder, even the
Exactly.
dementia or Alzheimer's.
Right.
could
So we have
go
this
there.
little tool, and it looks like a specific tool, and you use that to cut the strap off and then hide that baby.
Yeah.
And so
And then
forth.
in their minds they say that's the thing that takes it off,
Correct.
and that's the only thing that takes
Right.
it off.
And
So it's-
I've had a lot of success with elderly people with putting it on their ankle as opposed to a wrist, because it's out of sight, out of mind, and they don't even know it's there.
and the
after a
straps are
while.
long enough, there's enough space to put
Oh,
it
yes.
there instead of a wrist.
Right. Yep.
So you've had some successes already, I
Yes.
understand?
Yes.
I'm
Absolutely.
going to share a couple.
Yeah. Well, I tell you, when I
Tell me
didn't.
a good story.
Okay, I'll tell you a good one. When I didn't know about this program, I was still on the Marshfield Police. Actually, I was a Plymouth County Sheriff's, and I was in an area where there was a golf course on one side of the road and just all wooded area on the other. And I was driving down the road, and I saw this elderly woman walking toward me on the right-hand side. It was in the fall. She didn't have a jacket, no sweater, no pocketbook. And I mean, little old ladies don't go anywhere without a pocketbook.
Right.
So as I drove by, walking, she was just staring down at the ground as she was walking. So this doesn't look right. So I turned around and I went back and watched her again. And I figured I'm going to go down the road, turn around, and come back facing her, so I don't want to come back behind her and scare her. I went down, turned around at a curve, came back, and she was gone. And no cars passed me, and she sure didn't run away. So
Right.
I flipped the blue lights on. I get out. And I started looking around, and all of a sudden I'm hearing this little squeaky little voice. And I looked about 20 feet away from my cruiser. She had fallen down an embankment, and the only thing I could see was the bottoms of her feet sticking out. And she was upside down in these briars and stuff. So long story short, got her up, called for an ambulance, and they came and be waiting for them. She didn't appear to be injured physically,
Right.
but I just wanted them to check her out anyway, plus the fact that I didn't know where she lived, and neither did she. I asked her where she lived, and she pointed to the clubhouse at the golf course. And I said, do you live with anybody? Yep, my husband. Didn't know his name, didn't know her phone number. She said her name was Alice. When the EMS guys showed up, I told her, this is Alice, she just found, I want you to check her out. She goes, no, that's Mary. Her name is Mary.
They knew
and she
her.
lives with her husband in East Bridgewater.
Wow.
So her husband was a caregiver. He took a nap, probably thought she was taking a nap. So she
Right.
got up and walked out, and that was it. So fast forward to, I got on Marshfield PD, and I was a Council on Aging. I would go to the Council on Aging once a month because I was the community service officer, and they would have different talks on mixing medications or telephone scams for the elderly to watch out for. And this one month, they were talking about the safety net program. And having had that experience,
Yeah.
there's no question, this should be in every town in the country.
Right.
So at that point, I took it upon myself to let the people know in my community that we needed this program. And time went on, we got the program, and it's been extremely successful. It started in 2010.
Yep.
We went for 2 years with no search and rescues. And in the past 10 months, we've had 4. And they were all Alzheimer's patients, men. And the quickest one, he was found in 7 minutes.
Wow.
And that was at 8 o'clock at night. It was dark. He was about a half a mile from his house in a wooded area.
But they noticed him missing right away.
Right. We don't know about the right away, because his daughter had gone down the road to visit somebody in another house, came back, and he was gone. So he probably maybe had a half-hour jump from
Right.
the time he was reported, or from the time he left, actually.
Yes, yeah.
But the 2 officers put the gear in the cruiser, started heading toward his area. Quarter of a mile before they got there, they hooked on. They got a signal on his frequency, changed over to the Yagi, and found him right off the bat. And then there's another great story where there was a gentleman in Marshfield. I had actually put the transmitter on him myself, and he'd gone missing a couple of times, and he would always go in this one particular direction, and they would to a general store, and they would pretend that he had money, and they would give him a cup of coffee or a muffin or whatnot, and then he'd wander off and then couldn't get home. He didn't remember how to get home. Well, we got the bracelet on him, convinced his wife that that this was going to be a necessity because he keeps wandering off. She came to the police station after looking for him for an hour one day, and she couldn't find him. She went to the store, they never saw him. So the fella that took over the program for me, now I'm retired,
right?
He sees her walk in the front door, and he knows he's missing again. So
he knew just who it was.
Knew it was. So he grabs the gear, shoots right down to his house. In 18 minutes, one police officer found him stuck in the mud at dead low tide in the South River, and you couldn't see him from the road. So if we had to go on a conventional search,
right,
like we don't know which way he went, and we didn't have this to say he's over there, he would have drowned.
Yeah.
So that's a good story.
That is a great story. Yeah. So you have quite a few.
Yeah, yes. Prior to that, we had a search for a gentleman, 10 police officers, 2 canines, a helicopter, a $1 million ambulance on standby for 4 hours, and we couldn't find him. And just by luck, he wandered into somebody's open garage and got in the family's second car. And the family came home at 11:30 at night. They go to pull in. They see somebody sitting in the car. They're going, "Oh my God, someone's stealing the car. Call the cops."
Little did they know.
So the police show up, and that was him. So the good news is he got found.
Right.
We was not on this program. The bad news is 10 cops, 2 dogs, helicopter, and 4 firefighters couldn't find him.
Right. Wow.
So it's,
that's very exciting.
It is. It really is. It saves lives. It basically saves lives.
It just basically saves lives.
Exactly.
Yeah.
Yep.
Yeah. How many do you think you have out? Do you know how many you have out, like in the area that you work, or are you such a territory that you're?
I don't know the total.
Piece? Okay.
Yeah, I don't know the total. But in Marshfield alone, there's 28 people on the program. That's half and half elderly people and children.
Is there a fee for the person that has it?
Yes, there is. Right now, it's $99 for the initial setup and $30 a month after that. And it's
bargain, huh?
Oh, yeah, I mean, we spend more than that at Dunkin' Donuts.
Right.
But there's no contract for like a year, or something like that. It's by the month.
Yep.
And it can be terminated at any time.
Is it if someone's in a facility, it's sponsored by the family of the person?
Right. At this point in time, there is a plan right now that the company is working on to have facilities be able to purchase these transmitters, and there's a pilot program going on right now in Florida, where it's a home care organization where they send people out to homes. It's not a facility.
Okay.
And then
kind of like the VNA, right?
Exactly.
Yep.
And then somebody in VNA would say, "Hey, I've been to Mrs. Jones's house today, and it's a good possibility she may wander. I think we better, put her on this program." And then as time goes on, and then maybe Mrs. Jones becomes immobile and there's no way that she's going to wander off, that bracelet could be taken off and used for somebody else.
Ah.
So instead, so the organization, be it VNA or a healthcare facility, would actually own the bracelet.
And pay for a few, and they could transfer at will for whoever needs them.
Yep, and all of the other caveats go with it, as far as being accessible for the law enforcement, who would have access to our database. All of that's the same.
Okay. Wow. And how often do you change the battery again? 6
months.
6
Every
months.
It was 30 days. And the IT geniuses in the company figured out. I think
we got to do better than that.
What it was is that from what I understand, it isn't a better battery. It's the transmitter draws less power from that battery. So that's instead of lasting 30 days, now it lasts 6 months.
Yeah, much better.
And then with Marshfield, we connected it up with the fire department, and they chose to actually go to the houses of elderly people and change the battery.
Ah.
And at the same time, check the smoke detectors, check the carbon monoxide. Is the caregiver going, downhill? We need to get Council on Aging involved, or the VNA, or Meals on Wheels, and kind of stop the tragedy before it happens.
Right.
Where there's, you know, I've been on what law enforcement calls well-being checks. Somebody will call
Right.
up and say, I'm trying to get a hold of my dad for the last 3 days and he's not answering his phone and I live in California, you know, could you go, you know, check and let me know what's going on? And you go there and
Yeah.
the worst happens.
Right, right. Believe it or not, we only have a minute left. Is there anything
Okay.
that we haven't said that you wish viewers would know?
Well, I know this is probably going to be afterwards, but
Yes.
right now there's a bill in the House that's going to be voted on the 16th of October. And if that passes, this whole thing is going to, radio frequency tracking is going to be covered by insurance,
Excellent.
Mass Health, Medicaid, Medicare.
A big difference, yeah.
It will. It'd be a
Very
huge,
good.
because there's so many people. You know, like I said, $30 a month to a lot of people
Yeah.
is chump change, but
Right.
you know,
Dollar
it
a
could
day.
mean
Dollar
it
a
could
day.
mean meals,
Life
it
or
could
death.
mean medication.
Yeah,
You don't know.
right. Well, Ralph, thank you so much.
Well,
that was
thank you.
great information. I just love it. Yeah.
Thanks for having me. I
You're
really
welcome.
appreciate
We'll
that.
help get the word out.
Absolutely.
Yeah.
Thanks.
All right. And I'm Jean Sarnowski, wishing you good health and good health care.